and welcome to Docplexus News. The AYUSH ministry has proposed an amendment that will allow MD Ayurveda doctors to perform sonography and imaging tests after completing a 6-month training in imaging and radiology. The Indian Radiology Association has strongly opposed this amendment, stating that 6 months of training is insufficient as MBBS doctors have to spend 2 to 3 years to be qualified to open a scan center. They believe that approving the amendment can prove dangerous to the public health. The Drug Controller General of India has asked the Central Drug Laboratory at Kasauli to test all the batches of polio vaccines for type 2 strain to rule out any possibility of contamination. A WHO official has stated that this detection indicates the use of a vaccine containing the type 2 polio virus, despite the fact that vaccines containing type 2 polio virus have been phased out in India in April 2016 as a part of the polio endgame strategy. The two immunologists, James Allison of the US and Tasuku Honjo of Japan, won the 2018 Nobel Medicine Prize for their research into how the body's natural defenses can fight cancer. After announcing the prize in Stockholm, the Nobel Assembly stated that the therapy has revolutionized cancer treatment and has fundamentally changed the views towards the management of cancer. The US FDA has approved testosterone enanthate, a subcutaneous injection for testosterone replacement therapy. It is useful in men who are diagnosed with deficiency or absence of endogenous testosterone. The testosterone enanthate is a once-weekly subcutaneous self-administered auto-injector for men suffering from hypogonadism. The US FDA recently approved amikacin liposome inhalation suspension for treating lung disease caused by bacteria. This is the first drug to be approved under the limited population pathway for antibacterial and antifungal drug. The US FDA recently approved its first drug, semiplimab injection, for intravenous use for treating metastatic cutaneous squamous cell carcinoma. This drug works by blocking the cellular pathway known as PD-1 and helps the immune system to fight the cancer cells. The FDA also granted this application with priority review and breakthrough therapy designations. The IMA has issued an advisory to the hospitals and labs in Gurugram by which the rates for chikungunya and dengue tests have been fixed. This move came after the recent reports that diagnostic centers and hospitals in the city are charging a hefty fee in these cases. The rates for ELISA and NS1 antigen tests for chikungunya and dengue were fixed at Rs 600 and Rs 1000 for PCR tests for chikungunya. Bombay High Court has asked BMC to consider setting up a permanent medical board in its hospitals to deal with medical termination of pregnancy cases. The court directed the hospital to constitute a board in nearly every case to examine the petitioner. It will be the responsibility of the board to give an opinion on whether the medical termination of pregnancy cases should be allowed or not. These were the latest happenings in the medical field, brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!